Hi all, welcome to Physio Exam Buddy. In this video, we will discuss certain clinical scenario essay questions related to cerebellum as well as functions of cerebellum. First clinical scenario, a patient complains of difficulty in walking, talking, as well as not able to perform rapid alternate movements. So this will be a clinical scenario given and you have to answer the questions based on your knowledge in physiology. So here the main complaint is not able to perform rapid alternate movements. So rapid alternate movements, the main function of the cerebellum. So which part of the brain is affected? It is will be cerebellum. And enumerate the other manifestations of this lesion that we will study in this coming video. And describe the functional connections as well as functions of the part affected. Functional connections, it is given in video number 2 of the cerebellum, and functions you will study along with this video. Another clinical scenario question is, a 65-year-old woman was admitted to the hospital with complaints of intention tremor in the left arm. You know that the intention tremor, the word intention tremor or the sign intention tremor is usually seen in case of cerebellar lesions, and missing the target when attempt to do work. So on examination, the eye reveals nystagmus, that is a jerky movement in the eye. So answer the questions based on your knowledge in physiology. So what's your diagnosis? Diagnosis is cerebellar lesion. Mention the characteristic of the knee jerk in this patient that you will see along with this video. Then dysdiadochokinesia, that is one of the tests for cerebellar function, and describe the gait in this patient and give its physiological basis that we will see along with this video. And what happens when the flocculonodular lobe is damaged. We have already studied in the first video regarding cerebellum what are the functions or what are the tracts passing through the flocculonodular lobe, and in this video we'll study the functions of the flocculonodular lobe. So if that lobe is damaged, that the symptoms related to the flocculonodular lobe can be seen. Or it can be asked as a direct question, that is, explain the connections and functions of the cerebellum, add a note on the clinical symptoms seen in cerebellar lesions. So in this video we will first see about the functions of cerebellum. First, about the vestibulocerebellar function. It is mainly related with the equilibrium as well as the eye movements. So the fibers from the cerebellum project to the vestibular nuclei through the mediolongitudinal fasciculus, project into the motor nuclei of the 3, 4th and 6th cranial nerves. That is why it will control the eye movements in relation to the movements of the head. Next is about the function of spinocerebellum. It is mainly related with the control of muscle tone as well as posture. Another function of the cerebellum is error detection and correction. That is, we all know that the cerebellum receives proprioceptive impulses from all parts of our body. And it also receives a copy of the motor plan from the cortex. So what the cerebellum will do is that it will compare the plan with the performance so that error is promptly detected. Next function is the coordination of movements. That is, it will help to make the movement smooth as well as precise. That is, coordinate the rate, range, force and direction of the muscular activity so that it will help to prevent the overshoot of movements and to dam the movements. Next function is of the lateral cerebellum. It is mainly involved in the planning of sequential movements. Next function is the timing function. That is, lateral cerebellar hemispheres provide the appropriate timing for each succeeding movement. Next is the predictive function. That is, it helps in the anticipatory correction of the postural motor signals necessary for maintaining the equilibrium in a subject. Cerebrocerebellum is the one which helps to do the predictive function. That is, it will predict the rate of progression from the auditory as well as visual stimulus. Next function is the control of pre-planned rapid ballistic movements. That is, the muscle contraction that exhibit maximum velocities over a short period of time are not possible to receive the feedback signals before the movement is over. So, the entire ballistic part should be pre-planned and set into motion. Next is about the motor learning. It is with the help of the climbing fiber input, that is afferent connection. It will helps to alter the responsiveness of the Purkinje cells to the parallel fiber input. So it helps in the long-term modification of the MOSI fiber input to that particular Purkinje cell. Next is about the cerebellar lesions. So, in most of the clinical scenarios, you should identify the cerebellar lesions by seeing these symptoms as well as clinical features. So, first we will study about the causes of cerebellar lesions. It can be either thrombosis, that is block in the cerebral blood vessel, or cerebellar blood vessel, or hemorrhage in any of the arteries supplying the cerebellum, or trauma, any tumors, alcohol as well as drug are the causes for cerebellar lesions. And the main feature of the cerebellar dysfunction is that there will be no paralysis as like our pyramidal tract lesion. And here there is no loss of sensation. The only disorder appearing is the defect in coordination, equilibrium as well as muscle tone. So the main clinical features you get are, first one is dysmetria or pass pointing. What do you mean by dysmetria or pass pointing? It is just the error in judging as well as gauging the distance or speed or direction and force of movement. That is the dysmetria. Next clinical feature is the intention tremor. That is, it becomes evident on purposeful movement and increases in magnitude as the limb approaches the target. Next clinical feature is the rebound phenomenon, that is inability to stop a movement promptly. Next is this didocockinesia or adidocockinesia, means difficulty in the smooth execution of rapidly alternating movements. Hope you all are thorough with the dysdidocockinesia, which you are going to do in a subject while examining the cerebellar function. Next is the decomposition of movement. That is the difficulty in carrying out complex movements. So the breaking down of the act into the component parts and carried out with one joint at a time. So it will result in jerky, erratic, awkward and disorganized type of movement. Next is dysarthria, that is slurring or scanning speech. It is because of the lack of coordination of the muscles involved in the speech. So the speech will be usually slow, ataxic, slurred or jerky, explosive in type. Next is ataxia. Ataxia means the patient will falls to the side of the lesion, and the ataxic gait is usually a wide based stance like unsteady drunken gait. That is, there will be ataxia along with the disequilibrium. Again, the tone in that patient will be hypotonia and the knee jerk will be pendular type of knee jerk. That is, if you do the knee jerk, it will the reflex will be like a pendular movement. Then next is nystagmus, that is jerky, repeated to and fro movements of the eyeball when asked to fix the gaze towards a target on one side. So slow drifting of the eyes will occur towards the opposite side, which will be usually corrected by a fast movement. So fast component is usually towards the same side of the lesion. So that is about the functions as well as the disorders related to the cerebellum. Thank you.